Hi guys, welcome back to MHI's Roundtable discussion, where I'm here joined by our own Dr. Rudy Eberwein, my brother Mike, and the one and only Dr. Anthony J, who is coming all the way from Minnesota to be with us, and we're so excited to have him. Just so you know a little bit about Dr. J, he is the author of an amazing book, which I highly recommend, Estrogeneration, How Estrogenics Are Making You Fat, Sick, and Infertile. Dr. J was also a staff and scientist of the Mayo Clinic, along with amazing body of research on this very complicated area of science that is all around us and affecting our wellness every single day. And there are so few scientists actually talking about this.
I discovered your book, I think a year after it came out, and I read it 5 times. My wife was making fun of me because I was having fun reading this. Because the big thing what it did for me, so again, I've been a clinician dealing with patients for about 20 years now. I've been doing testosterone replacement and age management medicine for about 12 years. So I know how to treat patients, but I never knew the why. Why is this happening? Why am I seeing so many young men, young women with hormonal problems? What's going on in this world? The tendency of conventional medicine is that we blame the patients. They're fat, they're lazy, they eat bad, and then they don't treat the patient. So by the time the patients would come to me, they've internalized a lot of that shame because now they don't feel well. And then when I read your book, I'm like, that's it. There are all of those toxins, those estrogenics that I knew nothing about. And I've been an MD for 20 plus years. How is it that I didn't know about this? So for me, the important thing is first, thank you for bringing all this information. And our goal is now to bring it to our patients, to my physician colleagues, for them to understand that the world we live in now is not the world we were 40 years ago. We need to change our perspective when we see patients because we live in a toxic world.
Yeah, and Rudy, you make a great point, from a sort of patient management perspective. I get that question a lot. Why is this happening? Why is my health this way? Why is my testosterone low? What's the cause of this? And it's so hard to explain, right? And so I want to thank you for, just spending the time and the research that you have done to bring this to light, because this answers a huge why for us, right? And so maybe we can get into it and just kind of explain us how you got led into this path, because I know that this was a personal journey for you, and just kind of defining what estrogenics are, because when you say the word estrogenics, most people just kind of get glazed-eyed and they don't know what it is. So maybe we can start by defining estrogenics, what they are, where they are.
Sure. So estrogenics are chemicals that act like estrogen in our body. That can be natural estrogen, right? Like natural estrogen acts like estrogen in your body, but it can also be artificial estrogen chemicals, xenoestrogen, sometimes they're called. And what I've tried to do in my book is to categorize them, simplify it for people, because there's a lot of them out there, unfortunately. It's not just a simple like, oh, this is the one chemical that acts like estrogen.
Right.
And so what I think we should do today is break it down into 3 categories and say the food estrogens, there's a lot of things in our food that are disrupting our hormones, lowering our testosterone, we'll talk about it, acting like estrogen. There's a lot of things in plastics, not just BPA. A lot of people know about BPA. They say, oh, BPA is bad. It's not the only thing that's in plastics that's acting like estrogens. We'll talk about the plastics. And then the personal care products are a big major source of endocrine disruptors, hormone disruptors, estrogenics. So chemicals that are acting like estrogen in our body in an artificial way.
But
So very good.
To clarify, just for the public, because this is something that most people, I got confused. Phytoestrogens would come from plants. Xenoestrogen would be everything that's not food-based.
Correct. Phyto in Greek means plant. So phytoestrogen means plant estrogen. And plants have hormones, right? Like plants make hormones just like we make hormones. They make it from cholesterol, ironically, just like we make our hormones from cholesterol. And they're using their hormones for growth and for all that, just like we use hormones for growth and for development. But the plant hormones, sometimes they act like estrogen in our body. And that's a good place to start, actually, because soy makes an estrogen chemical, right? It's called isoflavone. And that can act like estrogen in our body. All scientists agree with this, by the way. All scientists agree soy acts like estrogen. Sometimes they argue it's good estrogen. Sometimes they argue it's bad estrogen. But all scientists agree it's estrogen. And so if you throw that into the mix and you say, oh, there's plastics, there's personal care products, there's a bunch of other chemicals that are acting like estrogen, and then you throw soy in the mix, now we've got a lot of estrogen, and it can be overwhelming for our systems, and you can start to see a lot of health impacts from that.
So estrogenics is your way of saying it all together.
All together.
Putting it
Plant
all
estrogens,
together, right.
the fake xenoestrogens.
Right, the bad estrogens.
They're all estrogenics.
Right.
And for the watcher, I just want to clarify and kind of contextualize this. This is an area where there's gonna be a lot of gloom and doom, but bear with us because there is a solution. And we just want to bring awareness to you, right? I think that the first step to change is awareness. And so, I think you quoted it geniusly in your book where you said, you need to be convinced that this is a reality and this is happening every single day of your life, whether you leave home or not, right? And so we need to define what they are. And, I think the good place to start is, where are they?
I think the first thing that we need to talk about first is, let's look at our society and the ills of our society. There is no questions that we've seen over the past 30, 40 years, huge increases in breast cancer rate. I think you said, what is it?
256% since 1980.
Wow.
In global rates.
Global.
Yeah.
400-fold increase in testicular cancer. 47 million Americans now have prediabetes. 90 million have metabolic syndrome. Diabetes is rampant. Obesity is rampant. ADHD, neurodegenerative disease like Parkinson's, like Alzheimer's dementia that is now called type 3 diabetes. Mm-hmm. So there's so many, and our society is trying. We have the most technology that we've ever had, but our society as a whole has the worst health we've ever had. So the bigger question for me is, okay, here are all the problems that we have. And we know, is it our food? Is it our obesity epidemic? What is it exactly? But there's no questions that there's a rise in a lot of those diseases. And as you said in your book, when did we start noticing a lot of this? It's the past 30, 40, and 50 years, where after World War II, we tried to create a better world via chemistry. And this is when plastic started. So as the rise of diseases going like this, the rise of plastics and EDCs went like this. So I think the first thing we need to do is, again, let's define estrogenics. So as you said, estrogenics is a chemical compound that binds to your estrogen receptors. That's simple. Now let's define the HPG axis, because this is where we were. So hormones are something that is really important. It's a very complex subject. So I'm going to try to make it very simple. So hormones are chemical messengers. This is how our body knows how to express behavior. So hormones are made in one part of the body, go through the blood and go to a different part. Example, insulin is a hormone, right? You eat sugar, your pancreas makes insulin, goes to the muscle, goes to the liver, and uptakes glucose into your bloodstream. Testosterone, it's made in the testes. And then when you have the right stimulus, testosterone is made and goes into a different part of the body and exerts its action. What's important to know is that our hormonal system is very tightly regulated. It's by nanogram per deciliter, a tiny amount, and there's a lot of regulatory feedback loops, meaning that if you have too much of something, just like a thermostat, then you turn off the production of some hormones. I think this is when I understood that negative feedback loop, that when you get that xenoestrogen, that artificial estrogen that comes in and binds to your natural estrogen receptors, it messes up that complicated system. The way I like to think about it is like if you have a nice watch, the watch, a Swiss watch, it has minute ways of keeping time. Imagine if you put 2 grains of sand into that machinery, the whole thing gets messed up. So estrogenics, those artificial compounds that's everywhere, goes into that HPG, the hypothalamus, pituitary, gonadal axis, creates negative feedback loop and messes up our hormonal system.
So in other words, what you're saying, these messengers, which are hormones, are being interrupted by the estrogenics that we're consuming. So
yeah, that's a good way to put it. Yeah, and the nanograms, just to circle back to that, what you mentioned, people need to realize, that's 10 to the minus 9th grams. That's 0.000000000 grams. We're talking about a really small quantity having an impact on your health. And so it's easy, it's a delicate balance.
So the other thing in your book that I liked, I didn't even realize, we have estrogen receptors everywhere. So again, for me as an MD, and I can imagine for the common person, when they think estrogen, they're like, oh, this is just in your ovaries, this is just in your breast, nowhere else. You have estrogen receptors from the head to toe, in your brain, your skin, your lungs, your gut, everywhere. So again, if you artificially bind to those receptors, disrupt those receptors, it's not just that you're going to have problems with sex or with our reproductive health. It includes everything. This is what's scary.
Exactly.
Right?
Yep.
So I think so far we've defined what are estrogenics. We've defined what are hormones and what are how a hormonal system works. I think for our viewers, they can see, wow, estrogenics, bad estrogen mess up a very delicate system.